Thank you for joining us either on the recording or live. We appreciate you taking the time to listen to us talk about a topic that we're super passionate about. So as a reminder, this is being recorded, so you can keep your video off and your mics muted. If you have questions along the way, feel free to drop it in the chat, and then we'll get to them at the end. So here we go. So I'm Brianne. We're glad that you're here. I own Pivotal Physical Therapy, which is located in Muncie. I focus on women's pelvic health. So we cover incontinence, urinary issues, bowel issues. A lot of my practice is built around childbirth and labor prep and postpartum, which I'm in the realm that believes postpartum is your whole life.
Oh, and I'm Emily Reynolds. I am the owner of ReSprout Therapy in Portland, Indiana. I'm a pediatric occupational therapist by trade, but I specialize in reflex integration and infant craniosacral therapy. We are so excited that you guys are all here tonight, and we're ready to share some information with you about childbirth for both mom and baby.
Okay, so again, like tech is hard for both of us. So when we hire people, we're going to hire tech people. Okay, so this is what, okay, I have to keep hitting this anytime you see. This is what we're hoping that you gain from tonight's webinar. So we want you to understand the importance of care during pregnancy, learn the significance of the birth process for both mom and baby, discover how birth affects the neurological development of children, learn how to advocate for your birth choices, gain understanding of steps to take when things don't go as planned. We want you to be able to discover how to support your child's development from the very beginning, and then learn how to support postpartum healing. So that's a lot of information to cover in a short amount of time. So please reach out to either one of us with questions and we'll guide you to the right person. And we will provide our contact information on a slide at the end of the presentation.
Okay, well, we hope you gain lots of information surrounding birth during tonight's webinar. Please know that this is for educational purposes only. It is not intended to replace medical advice. If you have any questions on the topics or the topics resonate with you, please reach out to one of us or your appropriate healthcare provider.
Okay, so we're going to jump right in, no time to waste. So we're going to start with the stages of birth. That way you have an understanding of kind of the foundation of what we're going to talk about over the next several slides. So from the mom's perspective, this is, post-pregnancy birth starts, the first stage of birth, you start to feel the contractions is early labor. And that is when you go from 0 centimeters dilated to 5 centimeters dilated. It can last from 6 hours up to several days. The contractions are going to be 30 to 45 seconds long, and then they're going to be 5 to 30 minutes apart. The mom during this part is usually feeling really anxious and excited. Then we move on to active labor, and that is when you are dilated from 5 to 8 centimeters. And it can last between 3 and 5 hours on average. The contractions are 40 to 60 seconds long, and they're 5 minutes apart typically. During this portion, the mom is usually focused. We're working on labor positions to help the baby move into position and relieve pain, breathing techniques, relaxation techniques. There's a huge focus or huge need for the labor support person. Then we move into the transitional stage, and that is when you move from 8 centimeters to 10 centimeters dilated, so fully dilated and fully effaced. That can last between 30 minutes and up to 2 hours. The contractions are going to be 60 to 90 seconds long, and they're going to be 1 to 3 minutes apart. The mom is usually, this is when things get a little bit more anxious, a little scarier. They're more dependent on their birth support person. And this is when that birth support person becomes really, really important. Then we move to the second stage. That's when you're 10 centimeters dilated and fully effaced. And this can last between 20 minutes and 3 hours. Contractions are usually 60 to 90 seconds in length, and then they're 3 to 5 minutes apart. At this point, a lot of times the mom is feeling relieved and energized, and she knows that meeting baby is right around the corner. I also included laboring down. And so this is when you get to that 10 centimeters dilated and fully effaced, but the mom doesn't have an urge to push. And so this would be without an epidural. So she doesn't have an urge to push. This can last up to 30 minutes. This is, the baby is not quite fully engaged, so this time is a good time to kind of rest and regain some energies for when it is time to push. And laboring down when you don't have that urge to push has been shown to decrease the pushing phase, so you don't have to push as long or as many times. It decreases the risk of cesarean, decreases the episiotomy rate, and then decreases the use of instruments during the birth. Okay, so the other thing that we look at during the birthing process is fetal station. So this gives us information on where is the baby in the pelvis. So here's my pelvis model. So we look down here, these are the ischial spine bumps right here. And so when we talk about fetal station, it's where, I'm going to use your baby. Yes. It's where the baby's head is in relation to those ischial spines. So if it's above the ischial spine, higher in the pelvis, it's going to be a negative number. 0 means the head is level with that ischial spine. And then positive numbers means it's below the ischial spine. So this is important to know because it gives the laboring person and the support people information on what we need to be doing or positions that we can be using to help that baby more fully engage and descend through the canal to make it, to optimize birth and make it really efficient without going too quickly. So it gives you more information. So this is stuff that we talk about during labor prep, which we'll cover in a little bit, but you can see our pelvis does have some movement. It has more movement during pregnancy and delivery on purpose. And so if the baby is in those negative numbers above those ischial spines, we want to be able to do movements that open the top of the pelvis. However, if the baby is engaged down here, we don't want to be doing that stuff because it's actually closing off where we're wanting the baby to pass through.
Okay, it is my turn. So now we're going to talk about the birth process from the baby's perspective. Okay, so birth, it's a really big deal. In my practice, I want to know, no matter the child's age, I want to know everything about the birth itself. So it plays a very important role in brain development. As you can see, and we'll talk a little bit about this later, but space as that baby grows is very limited. I like to know all the questions. I ask a lot of questions about pregnancy. I want to know the typical complications, but I also want to know about mom's stress levels throughout pregnancy. Another thing I'm interested in is the presentation and growth throughout pregnancy. I want to know if the baby was breech at any point. I also like to know what mom's job, does she sit at a desk all day? Like what does mom do and how active she was throughout pregnancy? And I'm asking these questions from the baby's perspective because that tells me a lot of information about the baby or child. Okay, so knowing all of these things helps me connect the dots to here's my baby to this baby. Knowing all of these things that happened beforehand tells me a lot about what's going on in here. Okay. Okay, so now we're going to talk about a little bit about, and we're just kind of quickly covering the basis of what are primitive reflexes. So primitive reflexes, a full-term healthy baby should have their primitive reflexes in the womb at birth. So they're developed in utero while they're still in the womb. They originate from the brainstem. They provide involuntary movement patterns, which help the brain and body systems to eventually perform targeted movements. Primitive reflexes are also there for protection and survival outside of the womb. Okay, so labor begins. Now we're talking about the baby side. So this whole process, this whole delicate dance between the systems of mom and baby, it kind of ignites this brain and these body systems, okay? So these contractions are priming the nervous system to be able to take over bodily functions. So these are like the most deepest stimulation you'll have in your whole life, right? And so this is one reason we need those contractions to stimulate this brain. Another question I typically ask is what was your length of labor? Was it precipitous? Was it too fast? Was it too long? Like, what are the complications and all of those things? I also like to know, how long did mom push? So this baby is born. So let's back up a little bit. Before this baby is born, they're in, full, like their sensory experience is completely different in the womb than outside, right? It's dark, they're in warm, they're in water, like all of these things. So the system. So now when this baby is born, there's a lot of transition and a lot of things that has to take over for this little brain and body. Okay. So for the first time, the full force of gravity is on this baby. They need to take over their own temperature regulation. Any kind of sense of urgency that was happening in this labor and delivery room, a lot of times, like that baby senses that as well. Or stress, that's going, not only felt by mom, but also by baby. Okay. Yeah, thank you.
Okay, so we know that each birth is different and there's lots of things that are unpredictable, but both Emily and I are huge advocates on becoming educated around the birth process leading up to birth, all the possibilities and the options. And this can help to minimize your stress during this adrenaline charged situation. And this ensures that you have a patient-led birth. So instead of just going off of what the provider might be telling you to do, you know how your body's feeling, you are equipped with all this different information to be able to approach your birth in a very educated, kind of head-on approach. And this improves outcomes for both the mom and the baby. As she mentioned, like with the stress, it calms down the stress a lot. And so that's good for mom and baby. So during prenatal care for mom specifically, it's important to establish a relationship with a pelvic therapist as part of your pregnancy care team. They're going to look at different things than what the OBGYN or the midwife or doula is going to look at. So during pregnancy, a pelvic floor therapist can help manage any symptoms that arise. So any aches and pains, any like pelvic pain, any urinary leakage, anything like that. And studies have shown that addressing those things throughout pregnancy instead of waiting until postpartum can be very beneficial and improves your outcomes postpartum. There's lots of changes that happen during pregnancy that are hormonal, biomechanical, postural, and this affects how your body functions. And so a physical therapist that's trained in that can help to guide that. We can help guide safe continuation and modification of exercises. And then we can manage any diastasis that occurs. We can help with pressure management of the system. And then we can do birth preparation for the pregnant person and their support person, which we've mentioned that's really important to have that good support person to help you through all of the things, and that helps with good outcomes. And so during this, we talk about laboring positions, pushing positions, depending on where the baby is in the pelvis and what you're experiencing, how the baby's positioned, different mechanics for pushing, what might be more efficient for your body, how to protect the pelvic floor muscles during pushing and decrease the risk of perennial tearing. And we talk about the inlet and outlet, like the fetal stations, how to help support that. And then we provide a lot of education and instruction for the labor support person, because sometimes the person laboring doesn't have, they can't necessarily advocate for themselves in that situation. And so they need a really strong support person to help with all of that. Okay, and then the postpartum side is we can look at scar massage, and that doesn't matter if it is for a cesarean or vaginal. You can have scars both areas, and so it's important to get that tissue working the way that it should be, and optimize how it's functioning so that you don't end up with other issues. We can help manage postpartum symptoms, so that can be any pain or heaviness, urinary and bowel dysfunction, any type of leakage or the feeling of not being able to completely empty, and constipation. And then we help to reconnect the pelvic floor and the core. So there's lots of changes that happen during pregnancy. Obviously, your posture and position change. And so we can help to kind of reconnect all of that and get your body back to previous mechanics. And then lots of body mechanics work. So you now have this newborn who has a heavy car seat, and you're bending over in weird positions, doing diapering, putting them in the crib, getting them in and out of the car. lifting, all this different things, breastfeeding. If you have older children, you're still caring for them and bathing and doing all this stuff. So we can talk through a lot of how to do that in an efficient way and optimal way so that you are caring for your body and not causing strain or issue. And then specifically, if you have a cesarean, there's lots of body mechanics. You know, you had a major abdominal surgery, and so there's lots of body mechanics and compensatory techniques and ways to get around so that you can recover and still do what you need to do. We also guide a return to activity. So this includes like your normal everyday activities, your work activities, but then also return to exercise. So whether you want to run or return to CrossFit or yoga or whatnot, we need to follow some guidelines to make sure that we do that safely and we don't end up with more issues. Okay. Good.
Yeah.
How are we doing? Yeah.
Okay. Okay, so now we're going to talk about the importance of craniosacral therapy for newborns and infants. Okay, so what is craniosacral therapy? So it is a gentle placement of hands to release the connective tissue or fascia. So very gentle technique, 5 grams of pressure, which they say is kind of like a nickel, like on your skin. Like that's how light this touch is. And so it's amazing. It releases tension within this body. Usually you can just kind of see this little baby and this little body like melt and kind of change it right there. Can be incredibly calming and organizing to the central nervous system. Okay, so now we're going to talk about the 7 cardinal movements of birth. So earlier we talked about reflexes. And so what that means is these primitive reflexes, this baby actually uses those reflexes during birth they are an active participant in this birth. They're not just along for the ride, like they are actually participating. And so these reflexes they're very specific movements, help them twist and turn and navigate down through that birth canal. And so these are instinctive, they're innate, they're reflexive, like it is ingrained in this baby and they just know what to do, and that mom and baby's bodies work together. So if by chance there's many situations that can happen during birth, right, that we have no control over. So in a full-term healthy baby, in a vaginal birth, like this baby should do these little cardinal movements, right? Here we go. Do your little cardinal movements, baby. So we're going to do our cardinal movements, and sorry, hopefully this stuff not happen, but go through, and then they push, they tuck, they turn, they look up, and then they'll kick and push themselves out of that uterus. So if by chance you have a C-section, right? So a C-section is necessary sometimes, like that is what has to happen. But that baby did not get to use those cardinal reflexes. So that is something that we can do in the office, and we'll talk about that in a little bit. Okay. Oh, sorry. You're fine. I don't know why I didn't. Okay. So now we're going to talk about what all we look at on these babies at ReSprout Therapy, and what we can do. So we showed that slide before about how that baby will grow into the space that is available to them. So uteruses are different shapes, different tilts. Like I said, it depends on like mom's activity, and there's so much that goes into it. But this baby is going to form in that space. So you can see. You can't obviously even point on your slide, but maybe you can. I don't know. No, wrong one. Okay, so I'm looking at these babies right here. Maybe you can see that. Okay, so you can kind of see these curves, these C curve, this
on the white background and the black background.
Yeah, so that could be considered torticollis. So that means like twisted neck or twisted spine. And so an example is like we have a sore neck when we sleep on the couch wrong, right? For like an hour. Think about these babies who develop this way, and they cannot tell you that they're uncomfortable or they're in pain. And so what happens is if they're going to stay in what feels good. And so I'm thinking not just short term, I'm thinking long term. So if I stay in one side and this feels good, I'm only attending to my right side. So my left side, my brain development, we're talking about hemispheres talking and coordinating together, and eye development, looking and crossing midline. There's so many things that go into this, that if we can change it from the very beginning, we can avoid all of those things. So infant craniosacral, we do very gentle techniques to help get the baby's body, release that tension. Let's see here. Okay, so also if a lot of parents ask about head shape. So think about, I have this poor little baby on here, sometimes I'm sure you've all seen pictures of babies with, and I'll show this too, like little cone heads, which they're supposed to, like this, when they're coming through that canal, these cranial bones are meant to come together. They're supposed to do that. But what they're also not, they're very good at contracting and molding to come through that birth canal. Sometimes they're not so good at letting go. Same with these cranial bones in this little face. So you can see this little guy, how squished up some of these bones get, and depending on what interventions are used, forceps, vacuum, that also changes what's going on. And so we can help to release some of those tensions and help this baby, not only for the short term, but for the long-term development. Okay, so we also look at latch and feeding issues. So a lot of times, and both breastfeeding and bottle feeding, but a lot of times moms blame themselves if breastfeeding isn't going well, like it's my milk supply, or like it's me. Like they, I think as moms, we tend to do that. We tend to take it all on, right? Well, I'm here to tell you, it might not be you, might be that baby. And so if things get tight in here, there's different little releases. We can go inside this mouth to reach different bones. From the inside, we can relax some muscles and do different releases to help this latch, or to help some babies coordinate like their suck, swallow, breathe pattern. If a baby is chompy or they're pulling and you're having a lot of pain, again, it could be going on in here versus here. Okay. So we also look at help with reflux and tummy issues like constipation. So if a baby is spitting up excessively, or you find yourself having to prop this baby up all the time, I'll use this baby. So if you're propping up your baby all the time, that's short-term help, that's helping them not spit up, right? What some parents might not realize is this vestibular system located inside these ears is also developing right now. So if baby is only held in one position, or they only sit in their car seat all the time, or in a baby swing all the time because they have to sit up, they're not getting all of this motion, and this vestibular system is not getting fully developed. So that's a really big deal, way more than we have time for, but in development, big deal. Let's see here. Babies should poo every day. So if your baby is not having poop every day, or they're straining to get it out, or becoming red-faced and grunty, that would be a really good reason to come see me. I'm really good at getting babies to poop. Very gently, yes, something we're proud of. Okay, so yeah, there's no need to have and I wish I knew this. My babies struggled with this big time. So had I known how easy it is and how to show parents how to continue it, it's a blessing for your baby. Okay, so we're almost there. So another thing that we can do up in the office is a developmental checkup. So not only, it's a lot of times these appointments kind of all blend together, but it's very important. I've got lots of little forms pre-built depending on your baby's age. So we're going to check the skills that your baby's supposed to be doing in that window. So we're going to check gross motor skills, fine motor skills, communication, cognition, visual motor skills, and developmental milestones. And so when we go through these things and we talk about them, what they are doing with ease, what baby is so easy for them, or I also have built into this form some red flags that is good to know as a parent. And then also built into this baby little report card that you can put in your baby book is like it's going to give you some information for the next stage ahead. So when you come to that appointment, not only are we looking at this baby right now, but now you've got things to work on for the next stage. And so I know when I used to go to the doctor, like they would give me like a little sticker that said their height and weight, and that was it. Like, and I probably put that in the baby book, but this is going to give you a lot more information.
Okay, so we both agree that the more information that moms and parents have, the better your outcomes can be. And so we just want to help share information and help provide care, and even if we're not the right providers for you, connecting you with the right people there are. So we like to connect resources and make sure that everybody's taken care of and have lots of like resources and support during this important time of life. So when we look at like Emily's side of the thing, when she's treating babies, a lot of things we just talked about, but she can help the baby after birth to feel comfortable in their body, reduce the tension in the head and the body. This is kind of a recap of what we talked about. Help calm and organize the neurological system, and then help with any issues that arise with baby as the baby develops, and then track the baby's development as they continue to age, so that you know what they're doing that's age appropriate, what they need to be working on, and then how to prepare for the next phase. On the mom side of thing, it's also important to be cared for in that postpartum time frame and beyond. We can help manage the symptoms during pregnancy. We can help to optimize the birth experience, prepare your body for the birth process. We're huge advocates for that patient-led birth, making sure that you have all the information, and then you can make an informed decision about your choices and how you want things to go, or which decisions you make. And then promote healing post-birth, making sure that you can return to the activities that you want to return to, and that you're able to fully participate in life without any limitations. Okay, so Emily and we're having so much fun with this collaboration that we are going to offer mom and baby screening. So this is stuff that we both wish that we had when we were new moms and postpartum and all the things. And so we want to be able to offer that to other people and share our knowledge. And some people aren't ready to schedule an appointment. It is a big commitment to schedule an appointment, and life is busy, and we get that. So this is a way to get a little bit of a taste of what her clinic does, what my clinic does, gain more information about your body and your baby specifically, or the baby to come, right? Because there's still things to do.
Absolutely.
And so we're going to be offering 1 hour mom baby screenings. It'll be a 30-minute appointment with me for the mom, and then a 30-minute appointment with Emily for the baby. And then mom and baby will stay together the whole time. So we'll transition from one to the other, just taking turns. So August 1st, we're going to be offering them at ReSprout Therapy, so Emily's clinic in Portland. And then on August 2nd, we're going to offer them in Muncie at my clinic, Physical Therapy. They will cost $50, and that will act as a $25 deposit toward an evaluation should you choose to schedule either at both places. So that $50 gets split both directions. So you could end up that way. So the baby side of things is going to look at developmental screening, and then you will receive that fun developmental report card, so you know where your baby's at, and you can put that in the baby book. If you are pregnant and the baby's not here yet, then what will that look like?
Well, I feel like that is still so very important that you've got 30 minutes face-to-face to ask all the questions about the baby side. Like, I know I gave some brief information, but there's so much more detail we could go into, but that would be a really good thing, I feel like.
And you can talk them through like what to look for post-birth, right?
Sure. And I could always give like a blank report card with like, so you still have that information on that newborn phase.
Yep.
So that would be a great thing.
And then on the mom side of things, we can kind of tailor it to what you like, but we can look at pelvic floor muscle dysfunction screening to kind of talk through what that is like and see if your pelvic floor muscles are working well. And then we can look at the diastasis recti abdominis. So that's when the abs separate during pregnancy. And then we need those to kind of function well again after pregnancy. And so we can look at that. And then after all of this, you'll get a nice email with a recap of both sections. Oh my goodness, I lost it. The deposit, if you want to schedule after the screening, if you want to schedule an initial evaluation with Emily or myself or both, that coupon, that $25 discount is good for a year, because we know that babies have to cook a while and not everybody is in the 9th month right now. So if you do want to schedule that, you can go to my website, pivotal-physicaltherapy.com, or you can scan the QR code on this page, or feel free to email either one of us and we'll get you connected with the right place. So now we're to questions. So we are so thankful that you guys spent some time on this Wednesday night and listened to us talk about things that we're really passionate about. As we were developing this, we kind of kept talking and saying, like, this could easily be a 4 or 5 hour webinar because there's just so much stuff that we want to share, but we tried to keep it short and sweet so that it was not too time consuming for you, but we hope you did get some good information and at least got you thinking about things to consider and things to think about with childbirth and postpartum on both the mom and baby side. So if you have questions, if you want, you can drop them in the chat and we will try to answer those. Or if you prefer, you can feel free to give us a call or shoot us an email and we will we'll get answers back to you that way too. So we appreciate your time very, very much. Okay, so I'm gonna stop screen. Is that okay? All right, so if we don't have any questions, then we're gonna assume that we just did an amazing job and we will go ahead and close out, okay? If you guys do think of questions after you're kind of processing, just let us know. Thanks. Bye.